brother. What's
boy,
up?
this is a
Hey, how you
groovy
doing?
party, man.
Yeah,
I
brother,
can
like,
dig it.
solid, right on.
What's
Hey,
up?
man, what's your name?
Good morning and welcome to the Earl Ingram Show. As always, you can join us at 844-967-2789. It's 844-967-2789. You can text us at that same number. Good morning to you, Calvin. How you doing, man?
I'm doing well. I'm counting down the days to the weekend.
Well, you've only got one more left.
Yep, we're getting close.
Yeah. It's going to be just blistering hot, man.
Yeah, that's what I've been hearing. But, as you always say, we got to take it because it's better than the rain and sleet.
Well, again, you could be in Las Vegas when it's now 15 straight days over 115 degrees.
Yeah, they can keep that there in Nevada.
All right. This is my favorite segment of, that I do. I do many segments on the Earl Ingram Show, but I have to say, and I enjoy all of them, but without question, this is my favorite segment of the Earl Ingram Show, and that's In the Pharmacy with Dr. Omar, the pharmacist. I just enjoy, the interaction with Dr. Omar, the impact that he has on so many people. And this segment, I'll tell you, it really does have a major impact on so many people that I talk to who listen to us. Dr. Omar, it's good to see you again, my friend. How you doing?
Good to see you, Earl. I'm doing great. I'm doing great. How are you?
Man, I'm doing fine, man. And, it's Thursday, so 8 o'clock, so we know there are many people listening. Let's talk a little bit about, I got quite a bit as always, but you had something in particular that you wanted to focus on this morning.
Yes, I wanted to talk about B vitamins and the importance of them for the body because we hear about them, we see them in the multivitamins. They are a group of 8 essential nutrients that play a pivotal role in keeping our bodies running like well-oiled machine. They help with energy, they help with the brain health, mood regulation, helps with the skin and hair care. And there is also some of us that take medications like metformin, like pantoprazole, omeprazole, diuretics, antibiotics. I'm talking about like medications that we use every single day, and these deprive the body from the B vitamins. And that's why they are important, and they are always a component of the multivitamin, but many times it's not enough inside the multivitamin. Many times we need to take more from the B vitamins. So they have many benefits, and then many times they are not checked when we do the annual check with the doctor. And some patients would suffer from health problems just because they're not taking enough B12 or B6, and that's why it is important to check. It's important to take. Women who are taking birth control pills, they have deficiency in B vitamins, so they would have problems with sleeping, have problems in their muscles, problem with muscle recovery, and that can be just resolved by taking B vitamins. And for candidates, people who take B vitamins needs to be taken twice a day because it leaves the body fast. So it works for 12 hours. So when we take it twice a day. And then finally, I just want to say and note that the good B vitamins turn pea color yellow. So for people not to freak out, that's what the B vitamins do because they are yellow. So
B12 or B6, how do you determine, and what's the difference between those numbers?
uh, big difference, and that's a very good question. B12 is the cyanocobalamin. So this is the most that people would need when they have a medication in their medication list, like metformin. pantoprazole, proton pump inhibitor. So this is the main one that they would have with the folic acid as well. So if you take folic acid, you need to take B12. So a lot of lozenges under the tongue, they contain the B12, and that's a daily dose. If and then there is also the B12 as an injection. So the more abundant that people take is the B12. The B6 is a vitamin that's important for the nerves, and that's also important for relaxation and important for digestion. So if someone is having problem with nausea and vomiting, B6 is a safe medication, a safe supplement to take.
You know, Dr. Omar, there's, I don't know, maybe every alphabet, has, has a vitamin named after it. Um, so all of these different supplements that you keep telling us about, if I took every supplement that's out there, I mean, how would I know what supplements I need to take? I mean, is there a doctor? Our doctors don't tell us, well, you need to take the B12, you need to take, the X or the Z or the Y. How do you determine what vitamins you actually need as we age to improve our bodies and what we're missing?
We start from the basics. That's a very good question. We start from the basics. I start from the medications that I take. So I ask the pharmacist, is there any vitamins that I need because I take these medications? So I start with the basics. And then in a good multivitamin, you would have enough of everything. You would have some of the B vitamins, some of the D as in David vitamins, some of the vitamin C. So I start with a very good core multivitamin. And then I ask my pharmacist about the medications that I take. What do they deprive the body from? And I go from there. But also, there is something that is called toxicity of B vitamins, someone who's taking too much. And that's why, this is a discussion that we can take with that we can run with our doctor. And then before the vitamins, I want to make sure that I'm eating healthy. So if someone is vegetarian, not eating meat, they need B12. So I always start from what do I have to take, and then what is going to help improve my health, improve my energy, improve my mood. All right. So we can have this discussion with the pharmacist because they know about this information. They study it in college, and it's kind of part of the consultation we do with our patients.
Let's go to Julie from Franklin. Good morning to you, Julie. You say what?
Hi, good morning. So I feel like I won the lottery because you just answered one of my questions. So I'll go quick. I have two questions. One's personal. So I take Eliquis daily, twice a day, folic acid, pantoprazole once a day, folic acid once a day, and bupropion once a day. And I'm wondering, can I take that with coffee? I know Earl had asked you, was taking something with coffee. I know I'm supposed to take that pantoprazole on an empty stomach and not eat for a half hour. I don't know if that's correct information. And then obviously now I guess I need B12 because I got folic acid and pantoprazole. So do I take that B12 right in the morning with all of those also?
Right, this is a very good question. You take Eliquis, which is an important blood thinner, but you take the pantoprazole. It's always recommended to take pantoprazole as a proton pump inhibitor half an hour before you eat. So as soon as you wake up, you can take it. So it would start working through the day when you drink a coffee and eat breakfast. I'd highly encourage you to eat breakfast every day, but you can just start with the pantoprazole, and then when you take the B12, because it's fat soluble, so it's good to take it with food because food is going to help with the absorption. And then when you eat breakfast, you can take the rest of the supplements. For what you mentioned that you take, you need to be taking the B vitamins like B12 And also, you will need to take probiotics because of pantoprazole. It changes the environment inside your gut, and it just kind of feeding yourself with good, healthy probiotics at least 6 months in the year will help you to be on the right track. Also, pantoprazole, longer than 2 years of taking it, will cause osteoporosis. So, you need to make sure you check your bone density and check your vitamin D levels. So, D3 and K2 in good levels are going to be important for your bone health, because that's going to be something we worry about after taking pantoprazole or omeprazole or Nexium or Acifex for 2 years. So
Hey,
you have
hey,
homework to do.
hey, Julie, hang on the phone a second. So, Dr. Omar, you talk about checking your blood levels. The only way we can get our blood levels checked is when we see the doctor. Sometimes we may only see the doctor once or twice a year. Is there any other way to get your blood levels checked to check all these things that you're talking about?
Yeah, when you go to the doctor once or twice a year, it will be like have a list of what you want them to check. So if you want to check, now you hear me talking about the B vitamins, ask the doctor to check the B vitamins. But there is a website self-serving that you can order the test for yourself. You just have to pay cash for it, but they are discounted, like lifeextension.com. You can go there and ask for any labs to have. And then when you get the labs, when you meet your provider, your practitioner, show them these lab values that you have. But these are kind of, you can always order it for yourself. You just pay out of pocket. But I highly recommend when you go see the doctor once or twice a year, just have a list of what you want them to check for you. And they're going to just kind of, insurance is going to pay for it, and you're going to request it, and they should accept it. Why would they say no? You tell them, I want to check my vitamin D levels. I want to check my vitamin B as in boy levels. I want to do a full thyroid panel. So that would be a good thing to use the services that the healthcare is providing you.
Hey, Julie, I wish I had more time. Thank you very much for the call. Thank you always for checking in. You are officially in the pharmacy with Dr. Omar, the pharmacist, on the Earl Ingram Show. 844-967-2789 is the number.
The following content is not intended as medical advice. Always consult your own physician, pharmacist, or healthcare professional for your own healthcare concerns.
Bringing you a passion for health and wellness. Dr. Omar Elewa is here to answer your pharmaceutical questions. Now, let's go in the pharmacy with Earl Ingram and Dr. Omar.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand. I have done all that I could to see the evil and the good without hiding. You must help me if you can. Doctor, my eyes.
All right, welcome back to the Earl Ingram Show. As always, you can join us at 844-967-2789. Text us at that same number. You're officially in the pharmacy with Dr. Omar, the proprietor of Welltopia Pharmacy in Mequon, Thingsville. And Calvin, I have to, again, man, give you kudos, man, for finding that song and connecting that with Dr. Omar. It's absolutely the perfect tune. Tom from LA, good morning to you, Tom. You have a question to come in for Dr. Omar. You are officially in the pharmacy with Dr. Omar, the pharmacist.
Good morning, Dr. Omar. I wanted to say thank you. Because of you, I've stopped taking omeprazole, knowing that was maybe just kind of a should have been a short-term thing rather than been a long-term thing. So it's like I have it here, but I take it as needed, and I really don't need it. I thought that it was something that was helping my stomach cramps or whatever, and it may have been, but since I haven't been taking it, and I take a lot of other really great vitamins, that I don't have that problem. So I want to thank you for that, so I don't become dependent on that. Second, what exactly multivitamin? Like I take, as an example, the Men's Multi by Ollie. It's actually like a gummy type of multivitamin. But what brand would you recommend for a multivitamin that covers everything? So we aren't taking, like Earl said, the whole alphabet. We're just taking kind of what it is that we need in one drug rather than having 10 different drugs.
Hey, Tom, thank you very much for the call, man. Good stuff.
Thank you, Tom. Okay, first, I'm happy that you're decreasing your dependence on the pantoprazole. Just a note that these medications, if you take them for longer term, more than 2 months, it's harder to stop them. So always do it with supervision from your doctor or your healthcare provider. I usually have patients wean down and over 3 to 6 months with patients with help with approval of the provider, because the proton pump inhibitor that is affecting this acid, it takes few days to reply back to you when you stop the medication. So some patients decide, okay, I am going to stop this medication now, and after a week they have acid reflux coming back with vengeance. So we always want to do it slowly. So that's the first point. The second point about the multivitamin. Multivitamins, unfortunately, some of the ones in the market, some of them are very famous. They don't have enough of what you need. Gummies also, because of the high content of sugar or dextrine or the inactive ingredients to make it taste good, they don't have enough. I have one in my pharmacy that I sell. It's called Active Life multivitamin, and this one has 2000 units of vitamin D, has CoQ10, has chromium, has B vitamins, and just I have men love it because it's just one capsule every day that covers for the main micronutrients that need to be taken, and then other than that they take some magnesium. So I would tell you, this is one of the good ones called Active Life, but you can only get it from my website. The challenge is like these multivitamins are like 10 times higher value than the ones that are found in the big stores. I know I am biased, but if I'm going to take just one capsule or two capsules a day to cover up for most of my nutrients that I will need, because I am a minimalist, I want to take the best.
So let
So
me ask
that
you,
is that.
Dr. Omar, as we age, our bodies need more of these things, and when we're young and our bodies and our systems are developing naturally, I guess the way we're created early on, it's a perfect balance. And as we age, we just kind of lose all those things.
To answer you in a simple answer, it's yes. To give you an example, I always talk to you, Earl, about taking CoQ10 if you are taking atorvastatin or simvastatin, the cholesterol medication. But also, if you are above 50 years old, by default, you are making less of this important coenzyme that affects your energy, your muscles. So CoQ10, at least 100 or 200 milligram for anyone above 50 years old, and they will feel the effect on the energy levels, on the blood pressure, just because we make less. So yes, our bodies need more help from the nutrients, and we're not going to get it from the foods that we eat if we keep the same eating habits. So I like the vitamins because it's like concentrated foods that we take. They just need to be precision. We need to know what we are taking and to review it. But if I have it a point in my head that I'm going to make sure that medications that I will take, I'm going to check what supplements I will need, and then the added supplements for energy, and ask smart questions to the right people, I will reach a good answer for myself and for the people that I love.
I take CoQ10, and you and I sat down and we talked about things. And I have to tell you, I've been taking CoQ10 now. It's got to be 5, 6 months, and my energy level is really high. It's a lot higher than it's ever been. Um, I've worked towards changing my diet. I feel great. You know, I turned 70 years old, and every time people see me, they don't believe that I'm 70. And
That's one.
and so
Good to
it's
hear.
part of it clearly is that changing what you put in your mouth that you always talk about is part of it. But, you know, the fact that I take a few things that you have prescribed for me, and I'm telling you, I don't miss every morning. I take it religiously, and
That's very good. Very good
and
news.
I feel better than I felt. This is just the absolute truth. In 15 years, you don't
That is
even know that
beautiful,
those
Earl.
things. Had I not talked to you, I wouldn't have been taking CoQ10. So let me ask you: had I not been taking CoQ10, and I would keep living my life without having that in my body, what would have been the outcome?
The outcomes can be that you would have low energy, brain fog. Your blood pressure can go up without knowing why it's going up while it's controlled before, and muscle. You're gonna have muscle pain. So eventually, you will go to the doctor, complain from those. The doctor will add a second and third and fourth medication to try to treat those symptoms, just because you're deficient in a key, important vitamin like CoQ10.
All right, hang on. 844 967 2789 is the number. You are in the pharmacy with Dr. Omar, the pharmacist at 540 AM WAUK and the Earl Ingram Show.
Jeremiah was a bullfrog, was a good friend of mine. I never understood a single word he said, but I helped him drink his wine. And he always had some mighty fine wine, singing joy to the world. All the boys and girls now, joy to the.
All right, welcome back to In the Pharmacy with Dr. Omar, the pharmacist, on the Earl Ingram Show. You can join us at 844 967 2789 or text us at that same number. Dr. Omar is the proprietor of Welltopia Pharmacy in Mequon, Thingsville. So, Dr. Omar, we've got some folk on the line, but got a question on the text. Allie, Milwaukee, for a person with osteoporosis, and acid reflux, taking calcium supplements and D3, and also Pepsid as needed, what vitamins should one take?
So for osteoporosis and acid reflux with Pepsid as needed, the challenge is like taking yeah, okay. So the main thing is to take vitamin D3 and K2. It's more important than the calcium. I like to take the calcium from the leafy greens and from the food sources. So if I eat a healthy breakfast, healthy lunch, healthy dinner, with colors of the garden, of vegetables and fruits, that will be enough for the calcium, because the challenge with the calcium is that many of the calcium are not the right brand and they cause calcification of the soft tissues like arteries. So if I take the calcium carbonate, that can be actually damaging to the body, not helpful. I have a form that's called calcium select, which is a different form of calcium that helps. That's more refined form. But the more important is to take vitamin D3 and K2, because the vitamin K2 helps to direct the calcium in the body towards the bones where it belongs and away from the soft tissues like arteries. And also the K2 is very helpful for the absorption of the in the direction of the vitamin D in the body. I have in the pharmacy a program that is 6 months, 1 year, or 3 years. It's like well made supplements and vitamins for bone health. And if taken every day of the year, after 1 year, the osteoporosis can be improved within 3 years. It can be treated. And these are concentrated amounts of vitamin D, of form of calcium that's plant based, of other ingredients that are important for the bone matrix, also include magnesium, strontium, because the bones are not just calcium. So, looking at it as a 3D picture, dealing with osteoporosis can be more than just D3 or K2 or calcium. And these programs, I just always check the drug interactions. I make sure that patients are not doubling on what they take, but they are very successful. And I've helped several patients to help treat osteoporosis and osteopenia, and that always happens with supervision from the doctors and practitioners. Actually, several of my patients are doctors who have osteoporosis that take those programs and they actually work. And that also helps a lot for patients who are not candidates for the bisphosphonate like alendronate sodium and other medications that can cause some side effects for certain patients, so they cannot take them. So there is hope, and this hope is just needs patience because it doesn't happen overnight. We need to wait a few months and few years to see better results when we go back to the doctor for the DEXA screening, which is the test to check on the bone density.
Let's go to Mike from Kenosha. Good morning to you, Mike. Thank you very much. You are in the pharmacy with Dr. Omar, the pharmacist.
Good morning. Thank you for taking my call. I just love listening to your show. I was doing some research a couple of years ago because I was trying to solve a health issue, and I like to go as natural as possible. And what I learned, according to a couple of different articles, is due to the big corporate agriculture, the quality of the earth, the quality of our soils has been tremendously taken back, to where now again the need to for supplements and to be do a little bit more due diligence in regards to your diet and your nutrition has become very important. I wanted to get your feedback, if you will, about the changes of our soil, which turns into the nutrient content of the fruits and vegetables that we eat.
Hey, it's a great question, Mike. Thank you very much for the call, Dr. Omar.
Yeah, I think just talking about the depletion of nutrients from the soil due to modern agriculture is true, and it happens. And then when we eat fruits and vegetables, there's no way to assess how much value is in it. So I like to go organic as much as I can, especially for the Dirty Dozen, which is a yearly report that comes out with the most fruits and vegetables that are subject to use of pesticides. So these usually there is apples and strawberries. I like to take them always organic, but it's true, and that's why we need supplements more than we need before. And then other people would take more supplements that they need, or they keep hoarding supplements, and then there would be too much of them, and then I don't know what is what. So it's kind of we have to find balance. But I agree with you. I like to eat whole foods. I like to eat at home and not eat like outside, and that helps a lot. But at the same time, we have to be realistic and we have to make sure that we take at least the basic ones. And the basic supplements that I need to take is a good multivitamin. I want to take omega-3 fish oil. I might need B vitamins because many medications would deprive them from the body. And then I would check my vitamin D and see if I need to take extra vitamin D vitamins so I wouldn't have osteoporosis. So we work on the basics and we go from there. But I totally agree with you, and I think just more focus on different ways of agriculture that's closer to how we used to harvest the plants before and the fruits before. I hope that this would be kind of happening. But the challenge is like organic foods are expensive, so finding the fine balance for most of the people is challenging.
Let's go to Sherry from Horicon. Hey, good morning to you, Sherry. You are officially in the pharmacy with Dr. Omar.
Hi, good morning, boys. My question is, so I take gabapentin, Cymbalta, vitamin D3, and lisinopril, and a little one for anxiety, hydroxy, something like that. My question is, I have osteoporosis, and so I'm on ibandronate sodium tablet, a band, ibandronate sodium tablet for the osteoporosis. I have a hard time taking that. I got questions about that. Am I supposed to just take that like once a week in the morning, like an hour before everything, or can I have coffee and stuff with it?
All right. So you're taking several medications. One of them is very important to take it as directed. Okay. Ibandronate need to be taken on empty stomach with a cup of water, not without coffee. And I think you take it once a month. And after you take it, you have to be active. Like you don't take it and go to bed and lay down and sleep. You have to move so it will absorb it better. But don't take it with coffee. Just take it by itself, empty stomach, because absorption of this medication is key to its effect. And this medication is helping to prevent more damage to the bones that you have. So it's a good medication for many patients. But as I tell you, don't take it with coffee. Take it away from anything else. Even if you take a thyroid medication, just take it away from anything else. Wait half an hour, and in those half hour, just be active.
Let me ask you on her behalf, Dr. Omar. The thyroid medication she takes first when she gets up in the morning, right? So what? How does she?
Yes.
So how does she? This other medication that you're talking about, does it interfere with the thyroid medication?
If she's taking a thyroid medication, the thyroid medication is taken every day, while ibandronate is taken just once a month.
Oh, okay.
Okay, alendronate, another form of the bisphosphonate, is taken once a week. So this one day a week or one day a month, we can part it, like take the ibandronate, wait half hour, and then take the ibandronate or alendronate, wait another half hour, and then eat breakfast and take the rest of the medications. It will be just an adjustment one day a week or one day a month, and then over adjustments for that.
Hey, Sherry, thank you very. Anything else, Sherry?
No, I don't have thyroid medicine. He used that as an example.
Oh, okay.
But my question was the half hour. So a half hour once a month, I can't have coffee, right?
Yeah, half hour you can't have coffee, so we'll wait for that. Yeah.
All right, Sherry, thank you very much for listening. Thank you for calling. Let's go back to Julie from Franklin. Julie, go ahead.
Hi. Okay, so Dr. Omar told me my pantoprazole for my ulcer. I had a ruptured ulcer, and I had emergency surgery a year and a half ago. That's why I'm on the pantoprazole. The ulcer's gone, but I have to take that. I also had blood clots after the surgery. I had a blood transfusion, and now I'm on Eliquis and the folic acid. And Dr. Omar just said that pantoprazole, if you're on that for more than 2 years, can cause osteoporosis. I just had a bone density test 2 weeks ago. I have osteoporosis, and they want me to take that once a week medicine. And my doctor did tell me to stand up and drink it with a full cup of water. Don't eat anything and stand up for 30 minutes after taking it. But I don't want to take that because it causes ulcers. And I don't. So I asked my GI doctor, is it safe for me to take the osteoporosis medicine? And he said, not. It does cause ulcers. So he didn't really, say yes or no, and didn't tell me anything. Didn't say anything else about the pantoprazole. Might have be a factor or contributed to the osteoporosis.
All right. So for you, you have already now osteoporosis, and the doctor gave you a medication that has a side effect that it can cause ulcer. If you take pantoprazole, it's going to help to protect you from this ulcer that can happen from the medication for osteoporosis. But the pantoprazole can also affect the osteoporosis and make the treatment for it take longer. The alendronate that you take, it works for some patients to help to decrease the damage to the bones, doesn't build the new bones. So I am thinking that we can look at what you take and we can create for you two programs. One program for gut healing to help you heal your gut and to decrease the dependence on the pantoprazole, and other program also to help you with your bones. Okay, that can help you also in case of alendronate did not work. So what I do, Earl, is that I meet patients and I create a program and a plan for them. I review it with the doctor to get their approval, because these are serious concerns. Is it the chicken or the egg? I'm taking the medication that's causing me a disease. Now I have two diseases instead of one. So I try to work closely with practitioners and create a plan that's going to be a working plan. So I recommend that you go to my website, schedule a consultation, and I think I have some good information for you.
All right, Julie, thank you very much for the call. Dr. Omar, we'll talk about how people can connect with you after we come back. You are officially in the pharmacy with Dr. Omar, the pharmacist, on the Earl Ingram Show.
Stayed in bed all morning just to pass the time. There's something wrong here, there can be no denying. One of us is changing, or maybe we just stopped trying. And it's too late, baby.
All right, welcome back to In the Pharmacy with Dr. Omar, the pharmacist, on the Earl Ingram Show. As always, you can join us at 844-967-2789. That's 844-967-2789. Text us at that same number. As you can see, Dr. Omar, with our callers and texters, you provide an invaluable service to people. And in this show, in this program that you're on with me every Thursday from 8 a.m. to 9 a.m. is really more impactful than I could have ever dreamt of. So we owe you great gratitude for the services you provide. How do people get in touch with you?
People can get in touch with me through calling at the pharmacy 262-429-9429, or they can go to the website to schedule a consult with me at www.wiltopiarx.com. Wellness and Utopia becomes wiltopiarx.com.
And Calvin, how can people who might have missed this because we're moving so fast, how can they find out they heard something they needed to follow up on?
Yeah, if you missed any part of this hour or any other one of our shows, you can go to civicmedia.us/shows and you'll find the Earl Ingram Show. You can also search the Earl Ingram Show on Spotify, Apple Podcasts, or wherever else you get your podcasts.
Thank you, Calvin. So Dr. Omar, Good RX Health is a website. And as I was going on it today, 2024's most influential drug and vaccine approvals so far as selected by Good RX pharmacists. And in it, there are 24 new drugs that are approved by the FDA for 2024. And I was just going through some of them. This is Vary, which is a new medication for COPD. And then it tells you about all these new medications that are coming out and that they are derivatives, some of them from other medications that they've been able to, make these adjustments to. For instance, it's OHTUVAYRE. I don't know how you pronounce it.
Yes.
It's
Otviri, yeah. They choose these kind of names that are weird, so they would stick in the brain because they want to market it for a long time.
so
But it's a new medication for COPD. Yeah, it's a new medication for COPD. It works. It works well. They are always trying to find the best medication for COPD and breathing. And the easiest way to decrease COPD problems is to stop smoking. But medications are needed also for many patients who are already having COPD. So it works by working on inhibiting both phosphodiesterase 3 and 4, which is work in a better way than the previous generation of the medication. We need relaxation of the airways. So someone with COPD have a problem that they have damage in the lung cells and they have problem in the narrowing of the airway when you breathe. Okay, so more relaxation to the muscle is always best. So it's a new medication that's approved by the FDA to improve the lung function and the quality of life for COPD, because unfortunately when COPD happens there is no way back. There is more damage that will happen in the future. When COPD happens, smoking cigarettes is a death sentence. So if anyone listening and they are smoking and a doctor told them you have COPD, the doctor is being nice. Please stop smoking.
Dr. Omar, it says it's the first, medication in over 10 years for COPD that they've approved. Here's another one. It's called WAKIX, WAKIX. It is an oral medication that's approved to treat excessive daytime sleepiness associated with narcolepsy, a chronic sleeping disorder. I guess the point I'm trying to make is, Dr. Omar, they are every day constantly working on trying to improve the lives of people and the science of medicine. Is that safe to say?
It is safe to say, but maybe you're having problems in what you eat that makes you wanting to sleep in the morning. It's easy to throw in a diagnosis of narcolepsy or throw in a diagnosis of problems with attention. Not like a lot of people have these kind of serious conditions, but it's not everybody. So I always try to look at the core ideas of: am I exercising? Am I depressed? How is my relationships? How is my the food, what I eat? And then I would look at the drugs, because the drug industry is focusing on finding and patching the symptoms without looking at the core challenge that we have. If someone is smoking cigarettes, let me give you this example. If someone is smoking cigarettes, they're not smoking one cigarette a day, all right? Not one cigarette a day. But if you smoke just one cigarette every day, you are a smoker. If you take the medication for the COPD, you take it once a day. So if 1-to-1, are you trying to kind of combat the smoking of one cigarette a day by taking the inhaler once a day? No, you may be smoking like 1 or 2 packs a day, and no COPD medication is going to go against that. So I like to focus on the lifestyle changes that I can do first, fix that, and medication is always going to help, but medication is not the hero. You are the hero of your journey, and improving your health is your responsibility, not the medication responsibility.
Dr. Omar, you are just a breath of fresh air, and it's always so great to have you on, man. The time just flies by too quickly, but it's always good to see you. We'll be back in touch again next Thursday. Have a great week, you and the family and all of those, your employees at Worldtopia Pharmacy.
Thank you, Earl.
All right.
Appreciate it.
844-967-2789. got a lot to talk about in the next hour. Especially the fact that I'm going to be at the Republican National Convention on next week, and so is Civic Media. 844-967-2789 is our number.